Hello everyone, welcome back to the Nurturing Corner with Shumee. We as parents a lot of times struggle to give our child a sleep routine, or we are trying to understand what co-sleeping means or what is good for our child in this sleeping pattern. So today that is what we are going to deep dive into.
Hindola, can you help us understand why this is such a critical milestone for both the child and the parent?
Yeah, Meeta, because like weaning and toileting, sleeping is also another milestone towards independence for the child. And unless the child can put himself to sleep and sleep through the night, the parent's sleep cycle is disrupted. So it's something that everyone's really waiting for, this milestone where they sleep independently.
When does this milestone actually come? When do we think that the child can start becoming independent? Is there an age that the parents should be looking for? Like at the now my child is 6 months, I can start training the child, or should he or she should be sleeping independently?
So, Meeta, there's no real age when the child starts sleeping independently. Like we spoke about temperament, based on each child's temperament, they start doing this independently at different ages. But there are some things that we can help with leading them to independence. Um, One is like Simone Davis in her book says, which I really like. She says, give as much help as necessary and as little as possible. So it's important that you do help and support your child to fall asleep, but only as much as necessary, because we normally tend to rock the baby to sleep or breastfeed the baby. Sometimes they even go to the extent of taking the child in a car. They fall asleep in the car. So, all these become sleep crutches. So we should avoid doing that to help them.
So I think maybe this also happens because getting the child to sleep is also important for the parents' routine and for them also to get enough sleep. So it becomes a very, and I sometimes think it also becomes a tussle between the child and the parent, right? Because you are also sometimes reacting anxiously. Why is my child not sleeping? And then one falls to this. So, is there, as a parent, something that we can do to set a routine, or like we spoke about the consistency earlier, the order? Is there an order that can help the child here?
Yes. So, firstly, it's important to look for cues when the child is tired. Because when the child is overtired, you must have noticed with your children also that it becomes very difficult for them to wind down. So, this winding down process should start when the first signs of tiredness are seen. And you should have a process that they know that, okay, once I start this process, that means I have to get to bed now. Like maybe, brushing their teeth, reading the bedtime story, and then putting them off to sleep. That's one thing. And the other one is to have the lights out fully. It should be dark. From birth to have the lights out at night, because when children are born, they don't have what we call the circadian rhythm. Circadian rhythm is all of us have it. All of us have it that when there's sunlight, we produce certain hormones which do not allow us to fall asleep. And when it's night, we don't have sunlight, then we fall asleep easy. That's the circadian rhythm. Children, when they're born, don't have this rhythm. And to help this, we have to take them out into sunlight when they're little, and to have a dark room when they're falling asleep at night to set this routine.
Okay. So, but then in the day also, if they have to nap, so is it important to have that dark kind of a setting that where there's no light coming and they are, or in the day it's okay to have a daylight and they know this is my day sleep and there's a night sleep?
Absolutely. That is important to not make it completely dark during the day, but to have go to the same place to nap during the day also, because that there should be one consistent place where the children can take a nap or go to sleep at night, whatever it is, but one consistent place for sleeping.
And again, is there like a duration that we should expect that as a parent, I'm going to do this for this time and my child will respond within a month, for example, to the routine, which I know it doesn't happen. But how do we as parents go through the process ourselves, right? Because that's very important for us to be comfortable for the child taking time or be consistently doing it. So is there something we can help ourselves also with in this process?
Yes, I mean, it is difficult because some children, their temperament is such that they do want to be with the parents more than other children, and they want the warmth of the mother or father's body next to them. And you really can't help that temperament of the child. And it's important not to force the child to be independent and sleep in another room, because it creates a very negative association to the child, and lots of fears also creep in. So, to work within the temperament of the child. So maybe I would say, because my child's temperament is like that, wants to co-sleep with us. So if and you want your sleep too, so you can have a separate bed in the same room maybe, and say, why don't you sleep here, and I'm here available to you whenever you need me. So that's something that you can, small things that you can work around to help.
Yeah, no, I think it's nice that you mentioned co-sleeping because, like, I had both my kids when I was in the US, and there I did not know of the concept of having a child in the separate room because, again, culturally, we as in India, it's very common to have your child co-sleep with you. But it was a shocker for me when my friends or someone would ask me, "Oh, the child sleeps with you. Shouldn't the child be in another room?" But it was very common in the US for the child to have their own room, their own bed, right from the time the child is born. And uh, and let the child cry also. I mean, there was this opinion also that let the child cry and they will fall asleep by crying, but you should not pick up the child and do it. How do we navigate such things, because there's so many different opinions on both the sides, right?
Yeah, it is, I mean, heartbreaking to see your child cry it out in sleep. Now, there's lots of research to suggest that, especially newborn children, until around the 6 to 7 month old, it's very important that they sleep with the mother, because newborn children need the smell of the mother, be able to listen to the voice or the heartbeat of the mother that stabilizes them. And making them cry it out and sleep in another room, what happens is the child is not getting used to it, but is dissociating from his own emotions. And that's what research says. So, our traditional practice of having our children sleep with us until at least, a few months is very important. And co-sleeping is something that helps the mother also, because the mother is still breastfeeding the child, and to have the child next to her is easier. To breastfeed and then fall asleep herself after breastfeeding is much easier for the mother and stress free for the mother. How long to continue co-sleeping is dependent on the parents. Depends on how long the parent wants it and how long the child wants it. And it's not the same. Children want it more than the parents want it. So like I said, you have to work it out. And also, maybe if the child is scared, one thing they can do is, once the child can start walking, to, even if the child is sleeping in another room, to let the child sleep on a low bed where the child can independently come out of the bed and walk to your room. Have your room door not locked, so the child has access to come into your room if he's scared or needs you for anything. And one more thing is that children do not have night terrors until they're about 2 years old. Yes, they do not have night terrors. There are other reasons for them to wake up at night, but not necessarily night terrors.
Also, like you mentioned, the co-sleeping part, again, just sharing, because when, so especially when you get like, as the child gets a sibling. So I noticed it with my older one. I mean, he was almost 3.5 years. He had started sleeping in his room, but then they want to come back to your room, because I think that's the emotional need that they feel at that point of time. So is it okay to let the child go through that, because that coming back continued for a long time?
I feel that for the attachment with the parent, it's something that they'll carry through their life. So I think it's important, because this older sibling is dealing with a lot with the younger one coming. There's so much attention being given, and the younger one has so much access to the mother with breastfeeding and sleeping. So the older one also wants to be part of this family. So to at least have the father sleep with the older one, um, or to have the older one also come in and sleep as a family, at least for some time, and then have a conversation saying, why don't you now go back? But I think it's necessary to give that emotional support.
Yeah, nice. Like even now, I mean, I have teenage boys, they've gone over the phase, but for a long time we had this reading routine. We would read, I would read, and before them, I would fall asleep with
Yeah.
them. But I think those things are something which help the kid, right? Like
Yes.
when you're reading them to sleep, and as they grow older, like when they go,
Yes.
right?
Yeah, that's because especially at night you wound down, and it's a time of calm for both the parent and the child. It's a great time to bond. That's the time when the children want to tell their stories about the day. That's a beautiful time for parents to have conversations about anything during the day, like any behavior that's bothering them, to have what happened that time, why did you react like that, just before sleep, to have these conversations also. It's a beautiful time for the
I too
parents.
you mentioned like routine is one thing that we can help, and maybe like for us, for me and my boys, reading work, like reading to them bedtime stories work, talking at that time. But every child is not interested in reading a book, right? So what are the other things that we as parents can do with them and wind them down?
Yeah, there are different things that parents do because not all children take to reading immediately, but you could sing to the child. I feel that's a beautiful bonding moment. And to listen, however you sing, not that you have to be a singer to sing to your child, to sing lullabies of your language. That is a nice thing to do. To talk about how your day went and what the child did throughout the day. And you can talk about the happy moments the child had during the day. So they have sleep with these happy memories and stories about your childhood or just general stories. There are many things that parents can do to wind them down and bond with the child before sleeping.
So also, like, we as parents work so hard to set their routine, get them into like sleep at a certain point, a certain time. But there are things which offset their routines, right? And then sleep is the first thing that gets offset. One thing is like when they start school, right? So they may be used to a nap at a certain time when at home during the day, but that school will have a certain nap time. So how do they adapt? Because that adaptation also takes time, and that also offsets everything. They may not sleep in school throughout the day, then they are tired when they come home, they sleep early. How do we navigate that situation? Because it becomes really a stress point for, I mean, personally, I know what it.
Yes, absolutely, because sleep regression is a real thing. And any important transition in the child's life, many children undergo this sleep regression. It may be a school or change of school or a sibling coming or a change of house. You know, so many things. It's a huge thing, huge change for the child, and sleep is the first thing that gets affected. And they will need the parent more than normal. Yes, you were being consistent and gave that whole routine, but now it's changing. But important to accept and be there emotionally for the child and give more support at that time. Maybe they'll need you to pat them to sleep. Maybe they'll need you to be in the room until they fall asleep. But to give that so that they make this transition with less emotions attached to it, because otherwise it's very difficult for them to see through what's going on at school and at
To our parents over here, remember that it's very important for you to cue into what your child is comfortable with, set a routine that works with both of you, and also be flexible at the same time to your child's need. And you will definitely set into a good sleeping pattern with your child. Hang in there, write into us, send us your questions. We would be happy to answer. Until the next time, bye.